Ms. Fisher, thank you for coming in today. I would like to just go over your annual physical and the portion where we ask women over 30 to fill out. Now here I see it says that you have numbness, dizziness, joint pain, trouble with hearing, speech, and loss of mobility and coordination. Is that correct?
Correct.
Alright, well here I have your eye exam and your ABR test, and during your eye exam it did show that you have eye weakness, dizziness, and that can also go along with your movement and balance. With your ABR test, which is auditory brainstem response test, again it's where we shot sound waves through your brain all the way up to your brainstem. Now what I found that waves 3 and 5 did have delays, which could be for early onset MS.
Well, what's MS?
MS is a nervous system disorder where your body foolishly attacks its own fatty insulators, which is called myelin. Now what this does is it will attack your auditory nerves and it will cause loss of balance, loss of coordination, and almost paralyzed movement.
Well, what tests do you do to find out?
Most times, just for precautionary, we will send you out for a spinal temp, also known as a lumbar puncture, and we will send out an MRI for your brain and spine. Now what this does is it looks for plaque all along the spinal cords and the nerves to see if there's any disturbances.
Well, how do you find it? Is it that the only way you can find it out?
Not necessarily. This is a process. It has to go through a lot of eliminations. There's not just one test to clarify, but going through these processes we can see which disorders or disease you might or might not have. Now, with your numbness and your dizziness and all the boxes you've checked off, it does correlate with some symptoms of MS, and I would like to go over some treatment plans, if that's okay?
Yes.
Alright. Well, it's not uncommon for women over 30 to have the possibility to have MS, but just to make sure, we do have these tests, and what we do is, again, we have the lumbar punctures, but if it does show up that you will have, or rather you do have MS, we highly suggest that you go to a physical therapist and a neuro doctor. This will just get you set. It'll help you with your movement, your correlation. You might have to go to a speech therapist because there are chances that you will lose some of your speech. Now, what I would advise you to do is cut back on fatty foods, start walking, even though you will experience, if you do have MS, some pain in your joints and you might have muscle spasms. You should work through it because the more balance you have, the more coordination you have, better chances you have. This is a progressive disease, and once it starts, I'm sorry, there's no cure. There were no preventions. All we could do is help you get through it so you can live a normal life.
Well, are there medications I can take?
There are various amount of medications. There are some for your actual symptoms. There are some for coordination, and then there are others just to keep you healthy. Now the ones I would recommend for the control of your symptoms are Xanaflex, and what's very highly recommended for just the actual treatment of MS, it says here's Avonex and Rebif.
Well, how common is MS?
It's not that common, but it's not that rare either. There are 250,000 to 350,000 known cases of women over 30 with MS. Now, it does not just attack women. Some men get it, but women are more prone to it. It's not any race. It's just women over 30 can have it. And I don't know if it runs in your family, but it hasn't been concurred that it is genetic, but we can say that's viral and immunologic.
Am I going to die from this?
This is not a death sentence, but it will progress to a point where it will make living very difficult. Now again, I do suggest physical therapy, all these treatments. You will have to get new medication. You will have to go for frequent MRIs just to see what level you go, because there's severe, there's moderate, mild, depending on where it is. But again, Ms. Fisher, I would like you to go out for these tests just to make sure, because I'm looking at all your health and your case file, and I just want to make sure that you will have the right treatments ready for you.
Well, thank you for taking the time, Doctor.